I am Dr. Heather Moore, owner of Total Performance Physical Therapy. Tonight we're going to talk about what to do when you wake up with a kink in your neck. So everybody's had this before. You might have slept on the couch wrong, or you might have slept in your bed wrong, or you were traveling. Whatever the case is, you woke up and you either couldn't move your neck or it was extremely painful to move your neck. And sometimes it hurt to turn your neck, or maybe it hurt to look up and down. Either way, you kind of woke up and you're like, I can't move my neck. So there's a couple of things that could have happened or could have gone wrong during the night. And it does take somebody actually looking at you to be able to diagnose what exactly happened. But there are certain things that you can do to not be walking around all day having to rotate your shoulders. So the first thing that you want to do is you just want to, first of all, relax. And I know that sounds very weird, and the first step is kind of odd, but a lot of times with your neck, as with most headaches or neck pain or shoulder pain, upper back pain, a lot of it results from or is exacerbated by the fact that most of us go like this and we stand like this. So what this does is it shrinks all the muscles in our neck up, and it actually causes a lot more pain. So when you wake up and you have a tremendous pain and you can't move anything basically but your eyeballs, some people have described it as, you want to make sure that you just kind of take a deep breath and relax. It will get better. It does take a little bit of time. It will get better, but there's no need to get all upset and try and start really moving around a lot. That's only going to cause things to get worse, only going to cause you to shrug your shoulders. So you want to make sure that you're nice and relaxed, even though it's extremely painful. And if it hurts to relax or it hurts to let your shoulders go, and a lot of people want to be up like this because it is sometimes a muscle issue, as you begin to relax and you notice, okay, if my shoulders are down here, it's excruciating, I can't let my shoulders down, you want to start taking deep breaths. So all you're going to do is just nice and easy, in through your nose and then out through your mouth. And you want to drop your shoulders, okay? Now, this may or may not work, and you still may be like, no, I can't move my shoulders. They don't want to go down. Every time I make them go down or move them in the direction of down, they hurt worse. So after you've done about 10 deep breaths and you've gotten your shoulders as low as they go, and maybe they go all the way back down and maybe they don't, and the next thing you want to do is you want to hop into a hot shower. That heat is going to allow increased blood flow. If you have a hot pack, go ahead and put that on. But with a hot pack on the neck, what you don't want to do is heat it up and then drape it over your neck. So you've got this thing just hanging over your neck and you're sitting like this and this large hot pack draped on your neck. If you're going to put a hot pack on your neck, you want to make sure that you lay down and you have a hot pack right there. This is really hard to do if you have a flatter hot pack because it's not going to get into that curve in your neck right in there. So you want to make sure that you have a nice hot pack that will actually cover and touch this area but not push it up so hard, because a lot of times when you wake up with that kink in your neck, it's really uncomfortable to lay down, and especially if something's pushing on your neck, you don't want that to happen. So a lot of times people will put a hot pad on, but they'll sit with it on because that feels better, or they'll lay on their stomach because maybe that feels better, or they'll lay down with it. So really be careful if you're going to opt for the hot pack as opposed to a hot shower. Hot showers are a really, really, really good option at this point in time if you wake up and you have a really sore neck. So you want to get into the hot shower. I recommend taking some really long, nice deep breaths in through your nose, out through your mouth. Let the water just fall onto your shoulders. You want to get it all over your shoulders, all over your head, all over your neck. Then what you're gently going to do is, if you weren't able to get your shoulders all the way down, you're going to start with your deep breathing again and allow your shoulders to come down naturally, nice and easy. Now it may take 10 breaths, it may take 20 breaths. All right, but you want to really focus on allowing those muscles to relax and allowing those shoulders to go back down as far as they can towards normal. The next thing you want to do is, if you find that you're having a hard time moving your head, all right, you do not want to jam your head or continuously try and move your head in that direction. It's going to hurt, it's going to be painful. What you want to do is you want to move it in the opposite direction first. So if, let's say, we can't turn our head to the right, you want to move your head to the left, nice and easy as far as it'll go. And then you're just going to gently bring it to the right. You're going to feel a little bit of resistance before you feel pain. When you start to feel the resistance, you're going to move back over to the left. And then you're going to keep doing this. This can take up to 5 minutes before you start to see a little bit of release. You may take your finger, and you may put your finger, your middle finger, or your middle 3 fingers, and put it right on the spot that hurts. You don't want to push it real hard, but just to apply some pressure as you're moving to the left and then to the right, nice and easy. Again, you don't really want to cause pain in this step. This is not something that should be painful, so you don't want to be pushing as hard as you can and jamming your neck over to the side. That's not going to work, all right? That's really going to actually exacerbate whatever you have. The next thing to do is to go from side to side. Now, if you're able to do side to side and have no pain, you should start with side to side. Or if you're able to look up and down and have no pain, you should start with up and down. Find the movements that don't hurt as bad and start with those. So if you're able to go from side to side gently, nice and easy, go ahead and do that. Again, you want to stop when you feel that resistance right before it's really, really painful, and then go to the other direction, okay? And just kind of do that. You can, again, take those 3 fingers, apply gentle pressure to that really pinpointed spot that hurts, and go from side to side, again, pushing on that, gently on that spot that really hurts. This is not for neck pain that you wake up and it's like, oh my gosh, my whole neck hurts. All this helps, but this isn't necessarily going to get you out of a chronic neck pain situation. This is just for those specific times that you wake up and you might have slept on it wrong, you slept on it weird, and you can't really turn your head, you can't move your neck, it's really excruciating. And then what you want to do is you want to move it into the up and down direction, okay? And you just want to, again, you can take your 3 fingers, put it on that spot, but wherever it is, if you can go all the way into looking up at the ceiling, then go all the way up and look at the ceiling. If you can only go a little bit, then that's where you go. Again, don't jam it into that range of motion that hurts. Take it gently. Start with doing 10 of each of those. It's going to take more than 10, all right? But start and see if each time you get a little bit further, a little bit further. Sometimes it can take 100 repetitions of this, nice and easy, loosening it up. The one thing you want to watch, though, is as you're doing this, that you're not starting to do this and shrugging your shoulders up, because that's going to kind of be counterproductive to anything that you're doing with your neck, okay? So if you wind up doing this and you're holding this isn't helping anything. So you want to look up, you want to look down, you want to look side to side. The final thing you want to do is actually do some rotations. Now, this is really going to be painful if you haven't been able to get almost full range of motion back. So if you start doing neck rotations and you've only still gotten to here with your range of motion, then you really want to be careful, because starting to do this can be extremely painful and you'll wind up actually causing yourself more pain. So you can skip the last step if you can't get it to a range of motion that's actually pretty good and pretty comfortable, but you do want to start with a small circle. You don't want to start like you would normally doing this massive circle with your neck, okay? It's just really tiny, all right? Nice and easy, and you want to go both directions, all right? So making sure that you are, again, in that pain-free range. You might feel a little resistant, that's okay, but you want to make sure overall it's not excruciating. And then you're going to move on to bigger circles, all right? Taking your time. You may not get to the bigger circles. There's no 100% faulty or surefire recipe with this, because everyone has their kink for a different reason. But these are some tips that you really want to pay attention to, so you're not walking around like this. Or I've seen people put some soft collars on themselves to make that better. What you should never do is put a soft collar on yourself unless a doctor has prescribed it to do, just to help a neck pain that's actually going to hurt you in the long run. So if you are one of those people that just automatically grabs a soft collar, it hasn't been prescribed by a doctor, that's really not a good thing to do. The most beneficial thing you can do when you have a kink in your neck is actually to move it, and it's so counterintuitive because it hurts, and I've had them. Been there, done that more than once, and you don't want to move, and sometimes it can even make you feel nauseous, and I've had the ones that make you feel nauseous. We want to just gently move through those range of motions. A little bit of a caveat though, if you're moving through these range of motions and it's causing shooting pain down your arm, or you're getting numbness and tingling, it's causing your arm to go dead, you need to go to the emergency room. You need to seek medical treatment immediately. That is a sign of something that's very wrong, and it's not okay to kind of keep pushing through, and that shooting pain down the arm and that numbness and tingling isn't going to go away with a hot shower and a few couple exercises. So if you wake up with a kink in your neck, plan on taking a hot shower for a lot longer that morning, and eventually it's going to loosen up.